Give it a chance. If you can get somewhere where somebody will let you in and get a bird's eye view, that's the best way. I'm Deborah Holland, and I'm a multi-modality imaging tech here at the hospital in Petersburg. My specialty is ultrasound, and I'm registered in that. But I started out as an X-ray tech, and I'm registered in that also, and then I also do CT. A pretty normal day for me is to have, say, an abdominal ultrasound in the morning, a CT abdomen pelvis in the mid-morning, and some sporadic just plain X-rays combined with that, and then the afternoon is usually on my end, it's usually OB ultrasound. I always knew I wanted to be in the medical field, and an opportunity presented itself. I had a friend who was in the X-ray program and told me about it, and at that time they paid me to go to school, so it was really great. And then I found out about ultrasound, and that was my next step. It's crossing over from X-ray to ultrasound, and that's really been where I stayed most of my career until I came to Petersburg. And in Petersburg, we're a small hospital, so you do more than one thing. Working with patients, I really have an empathy for people who are in need of health care. I guess I have a heart for it, and I like dealing with patients. One of my favorites is my pregnant women and their families. That's a real uplifting. It's real gratifying to be able to take someone who's hurt and they don't know what's wrong with them and take a picture that shines a light on what the problem is, and a diagnosis can be made and patients can be treated, because there has to be a diagnosis before they start doing something to fix the problems. And a lot of that diagnosing starts in the imaging department, more and more all the time. Well, I think you, first of all, have to be able to come to grips with the less than septic side of medicine. You can't be that squeamish. You can start out squeamish. I mean, I used to almost pass out sometimes during procedures, but you have to want to. You have to have a desire to get past that. Some people can't get past that. The smells, the looks, there are things that are not pleasant in the medical field that you'll come across sometimes, but you have to want to. You have to have a desire to care for sick people and to get past the things that might be repulsive to you, so that you can help them. I think a really good thing to do is volunteer at a hospital. If you have a hospital near you that has candy stripers or lets people, some high schools have actual plans where you can actually experience some of these things firsthand, then you're gonna know if you want to do that. You're gonna see the people doing it, and you'll be able to pick up on that.